Welcome to the Red Light Therapy Podcast, brought to you by Platinum LED Therapy Lights, the pioneers who spent 15 years building the world's most powerful red light technology. In each episode, we show you how to use that power to heal your body, save time with shorter sessions, and get the professional-grade results you deserve. This is the science of the light, simplified for you. And now, your host, Mike Volkin.
Hello, everyone, and welcome to another episode of the Red Light Therapy Podcast. Our co-host today is longevity and sports performance specialist from West Texas. He's been on the show before. Welcome, Dr. Alan Inman.
Hey, everyone. I hope you guys are ready for learning about something really special. We're all worried about one thing, our hair.
This is going to be a good one. Dr. Alan Inman has 2 clinics in Costa Rica and is a medical director of a stem cell clinic. And as a red light therapy expert, he's going to be sharing his wisdom so you can make the most out of your red light therapy device. As a reminder, this episode and all others are going to be quick, less than 15 minutes. So make it a habit when you do your red light therapy sessions to pop in one of these podcast episodes so you can learn red light therapy while doing red light therapy. So today we are starting an aesthetic and longevity series. The main topic today is going to be hair regrowth. Okay, first off, this is important to me because I'm kind of losing my hair. I just turned 50 last week. So is red light therapy a legitimate fix for hair thinning?
Okay, so what we're going to look like when we see these medical studies, we're going to find that this is of the few non-pharmaceutical intervention that consistently has clinical evidence towards helping androgenetic alopecia. So this is the type that we're all dealing with because of the fact that it's hormone-based. And so this isn't a cure, but it's biologically an active treatment. So it's going to help you big time. It's just not going to cure you from a circumstance in which you have, which has to do with the hormone.
Now, I've read a lot of studies on this, and I know that red light therapy and hair regrowth are scientifically proven. That's without a doubt. Numerous studies have shown that. But I'll have to admit, I'm a little ignorant on the fact with how exactly can something as simple as light actually wake up these hair follicles. Do you know the science behind that?
So it works like this. So what we're going to find is that it increases energy, which we have spoken about before, which is ATP. So if you have more energy, it's going to help the follicle with its activity. Then it's going to decrease the inflammation that's going to be around the follicle, which is perifollicular inflammation. So it's going to help us with miniaturization. What's miniaturization? So that means the thinning of hair. And on top of that, it makes it even smaller. That's the term miniaturization. And so if your hair is getting more miniature, it'll reach a point in where it'll leave a scar spot. That means you don't have any way to fix that. That means you lost that hair follicle forever. So we want to use that red light therapy to keep it from reaching that moment. And then it's going to help with the microcirculation. So what we're going to help is be able to get all the nutrients and oxygen to be able to get to that follicle. And at the end of the day, we're going to find that it has helped, in clinical studies, up to 19 to 30% of hair density in men. And in women from 37 to 40, which is huge if you think about it, because if we start comparing it, for example, with minoxidil or finasteride, which are therapies that people are using, whether it be topical or oral based, it is less or barely reaching what red light therapy does. So that's pretty huge when we look at it in that context. And we need to know that what it's doing is there are 3 phases of the hair. So there's anagen, there is catagen, and telogen. One is growth, which is anagen. Catagen is that transition stage, and then telogen is the resting stage. So what it's doing is grabbing that resting stage and putting it into the growth stage, which is what we want, because that means we're going to have more hair growth.
And how many months or weeks or years does it take to see new growth?
Okay, so this is what So this is what's going to happen when we look at the timeline. So weeks 4 to 8, what we're going to find is there's reduced shedding. So you're losing less hair. So remember, we're getting from that resting or shedding stage, which is 10% of that hair, and it's taking it back to anagen. And then what we're going to find between weeks 12 to 16 is there's early regrowth of these follicles in that area. And what we'll find is that they're fine hairs. And then from months 4 to 6, there's going to be more visible density improvement, which is what we're looking for. But you got to be patient because the hair is one of the slowest of all the cells to be growing. So you can't expect something to just go bam, immediate, like we were talking about in the earlier episode, which had to do with hair, with the skin. And we were trying to say, hey, it's not immediate. You got to be patient because this is a biological circumstance which you got to let take place.
Yeah, red light therapy in general is not a fast food of medical devices. It's something that's easy to do, and it's actually comfortable. There's very non-invasive, but you have to be patient and allow it to happen. So this next question is kind of two-part. First of all, does it work for both men and women's hair loss equally? And second of all, what about the different types of hair? You're a redhead. Should you expect different, experience than me, who's not a redhead? So how exactly does the different types of hair play into that?
So it's going to work for both men and women. We're going to find that in the case of men, it's going to work on something that's called androgenetic alopecia, which is the hormone-based, which I was telling you. And then in women, it's diffuse thinning, which you'll find more towards the middle. And so they start to lose it here. What we're going to find is it's going to help slow down the miniaturization, extend the growth phase in the context of men. And so that's really important. And it's very important for women because there is no like hormonal treatment base that's really valuable. And so by giving women this option, it's significant. And with clinical trials, like I think I had told you before, it increases up to 37 to 40% of density in women. Now, if we're looking at the different types of hair color, this is what's interesting. So blonde, then redhead, brunette, black hair. Okay. So if we look at this division, the components that are lighter hair colored, like in my case, they tend not to absorb so much of this light. So more of it will penetrate to get the scalp. Those who have darker hair tend to absorb that light, meaning that the importance of getting closer to the scalp is even more important for those who have dark hair, because sometimes it's like, I don't want it to be so close. Well, if you don't have it close enough, you're not going to get the effect you're looking for. So it is very important because your hair will absorb that light in comparison to someone who's blonde or redheaded.
Wow. I just learned something new. Okay, that was excellent. So I have a friend with a real patchy beard. I'm wondering, does it work on beards and eyebrows too, or are we just talking about hair on the top of our heads?
Yes, it does. There are less studies in beards and eyebrows, but what it has shown is it does increase the density in the beard and in the eyebrow. Less so in the sense of trying to look at the eyebrow just because of the fact that there's been less studies, but there's more evidence in the fact for beards. So if any of you guys are suffering of having, those patchy spots in your beard, well, this is a way to be able to help.
Sounds like it. Yeah. Does the light need to be touching the scalp? Like how, you said in a previous episode, 6 to 12 inches, but really how close can it get when it's actually not effective?
Okay. Well, in the case of looking at the skin is one thing, but then when we look at the scalp, we need to have it or touching or 2 centimeters far in distance. So it needs to be really close. The reason being is we don't want to lose that density of photons reaching the follicle. Like I said before, we need to be able to have the photons reach so that we can have the component of helping the follicle to grow, to decrease the inflammation so you don't have the miniaturization, and so that we can get those nutrients, oxygen and nutrients, to be able to reach, which is in hypothetical terms, what one of those meds that I had mentioned before do is hypothetically it helps oxygen and nutrients get to that component. So that's what you're doing naturally with red light therapy.
Okay, well, does it help the hair grow back thicker, or is it just more of it?
Okay, so it's going to help with the density and it's going to help us with the thickness. So it will visibly show as if you had a lot more hair. And it's more important to have thicker hair than the amount of hair because then it covers more area. And so whenever you're doing this, yes, people are going to go, over this period of 4 to 6 months that I've been doing this, like I said, again, consistently, wow, all of a sudden, now I'm seeing an effect. So you do have to be patient with this. But with that patience, you didn't have to go look for hair implantation. You were able to get it all done with natural means.
Honestly, it's like working out. It's like, I mean, it's even easier than working out, but if you're consistent with working out, you're going to get healthier over time, more and more healthy. I think it's the same concept there. It's just patience and consistency, right? So great. Dr. Allen, every time I hop on an episode, I think I'm not going to learn anything new, but then I always do. So thank you very much for joining us. I look forward to having you on for future episodes. Thanks again.
Thank you.
Thank you for joining us on the Red Light Therapy Podcast. While others imitate, Platinum innovates. For over 15 years, Platinum Therapy Lights remains the pioneers and global leader in the red light therapy industry. Access the same technology trusted by medical professionals, researchers, and peak performers worldwide. Now, it is your turn to experience the Platinum LED difference. Visit PlatinumTherapyLights.com to secure your professional-grade results today.